Assalamualaikum and hi. Today I will present about pandemic disease, lesson from COVID-19 and future preparedness. Biologically, COVID-19 show four key concepts. First, mutation like new variant Delta and Omicron change transmissibility and severity. Second, transmission through droplet and aerosol explain why masks and distancing were effective. Third, immunity. Our innate defense and adaptive antibody response shape infections outcome. And finally, vaccination, especially mRNA vaccination, train the immune system and help country reach herd immunity. These biological concepts shape many real-world impacts during the COVID-19 pandemic. In Malaysia, hospital and healthcare facilities were pushed to their limits, with ICU occupancy exceeding to 90% during peak wave in 2021. Doctor and nurse faced exhaustions and patients with other illness also struggle to get treatment. To slow down the transmission, government enforced multiple movement control order which restrict travel, close school and shift education and work to online platform. In the South Korea, the response was different. The government avoided strict nationwide lockdown by relying heavily on the mass PCR testing and digital contact tracing. This allowed them to identify positive cases quickly, isolated them, and reduced uncontrolled community spread. Meanwhile, New Zealand implemented some of strict border closure in the world. For nearly 2 years, international entry was tightly controlled, and this strategy delayed widespread outbreak until the Omicron variant arrived. However, not all impacts were positive. In many countries, vaccine hesitancy slowed progress, leaving some population vulnerable for longer and allowing the virus to continue spreading. This clearly shows the strong connections between biological concepts such as transmission and immunity and the social, political, and economic decisions that shape outcome in the different countries. So here we see the data and case study that reflect the real situation during the COVID-19. These numbers are important because they show not only the skills of the pandemic but also how different strategies produce different outcomes across the countries. According to the World Health Organization (WHO), by mid-2023 there were more than 770 million confirmed cases worldwide and over 7 million deaths. This shows how fast the virus spread globally and how serious the impact was on human health. In Malaysia, more than 5 million cases were recorded by the end of 2022. At the peak of the pandemic, daily cases reached over 2,000 and ICU accompany went above 90%. However, the vaccination program achieved more than 95% coverage, which reduced severe cases and deaths in later wave. In the South Korea, the strategy was different. By 2021, the country had conducted more than 40 million PCR tests and used digital contact tracing. As a result, their mortality rate remained below 1.2%, which was far lower than the global average. New Zealand also provides a strong example. Through strict border closure and quarantine rule, the country managed to keep cases below the 50,000 until the Omicron variant in later 2021. This gave them time to roll out vaccine before community spread began. If we compare the situation now in 2025, Malaysia has around 5.34 million cases in total. South Korea has more than 34 billion and New Zealand has over than 22.5 million. Mortality rate increased slightly during the pandemic, while natality rate declined as many families delay having children during the crisis. This statistic and case study highlight the importance of both biologically and policy. The virus may drive infections and mutation, but government strategy and public behavior decide how severe the outcome are for each country. From the COVID-19, we can learn many valuable lessons both at personal level and the global level. First, people realize the importance of personal hygiene. Practice such as frequent hand wash, mask wearing, and the use of sanitizer become the parts of daily life and provide effective in reducing the transmission. Second, The pandemic showed that healthcare system must be better prepared. In many countries, hospitals were overwhelmed and the ICU beds were full. This taught us that stronger facilities and more trained healthcare workers are necessary to face the future crisis. Third, vaccination emerged as one of the most powerful defense. The rapid developments of vaccine, especially the mRNA technology, not only saved millions of lives, but demonstrated the importance of science and innovation. Fourth, the pandemic highlighted the need to protect our mental health. Lockdown and isolation cause stress, anxiety, depression, remind us that mental health being is just as important as the physical health. Fifth, global collaboration become essential. Programs like WHO coordination, the COVAX for vaccine sharing show that no single country can fight a pandemic alone, and cooperation is the only way forward. Six, the One Health concept was reinforced. COVID-19, which most likely originated from animal, remind us that human health is linked with animal and the environment. Pandemic are just not medical events but ecological and global event too. Finally, the seventh lesson is the power of technology and innovation. The use of digital tracing, telemedicine, and AI or artificial intelligence improve response, while mRNA vaccine prove how fast science can adapt to new challenge. So, after the learning from the lesson from the COVID-19, it is also important to look at how we can prepare for the next pandemic. Preparedness is the key to reduce future risks and saving life. First, healthcare system must be strengthened. This means building more hospitals, expand the ICU capacity, and ensure that the doctors and also the nurse are trained to handle sudden surge in patients. Second, vaccine access must be equitable. During the COVID-19, rich countries receive vaccine earlier than poor one, and this creates inequality. For the next pandemic, every population must be protected at the same time. Third, early warning systems are essential. Using genomic sequence, AI, and the data sharing new diseases can be detected early before they are spread globally. Fourth, government must stockpile essential medical supply items such as PPE, masks, ventilators, and medicine should be ready in advance to prevent shortage during the emergency. Finally, public health education is vital. Community needs continuous awareness about hygiene, about vaccination, and the disease prevention so that misinformation does not create fear and also resistance. To the end of this presentation, I would like to highlight the main message. COVID-19 was not only a health crisis, but also a biological lesson for the world. It showed us how virus mutate, transmit immunity, and vaccination shape the course of the pandemic. We also saw its real impact on healthcare, economies, and society. And from this experience, we learned important lessons from the personal hygiene and mental health to the importance of the science, innovation, and global collaboration. The future will certainly bring the new outbreak, but with stronger healthcare system, early detections, fair access to vaccine, and continuous public education, we can reduce the damage. So the key message is clear. Science and unity are our strongest defense against the future pandemic.